Hello everyone, I am Dr. Santosh Kumar, orthopedic and joint replacement surgeon based in Kolkata, India, and I am the founding director of the Momentum Orthocare. Well, Momentum Orthocare represents combination of our skills and our education and knowledge. It is not a hospital, but it's the team, and it's the team of me, and along with me we have another 5 orthopedic surgeons and healthcare professionals, and we are extremely dedicated to bring the highest quality of orthopedic surgery available in Kolkata and Eastern India at the most affordable prices. We have been doing knee replacement since more than 18 years now, and we have continuously followed up all our surgeries, and we have strived for improvement rather. We have always tried for improvement, what better we can do, and we are one of the pioneers in doing both knee replacements in single sitting. We have always followed up the results, the recovery, the pros and cons of everything since last decades, almost 2 decades, and we have come to conclusion that in many cases UCare is the answer. So UCare means unicondylar knee replacement, and UCare, the beauty of UCare is that the recovery is really fast and the feeling of the joint is absolutely natural. One will not generally not remember that knee surgery has been done. The recovery is really fast, and the level of activity is higher in UCare. But we will discuss and see that UCare, whether UCare or TCare is needed, it can be decided only by the surgeon. It cannot be decided by the patient, because it needs a lot of knowledge and understanding to decide whether UCare or TCare is needed. And we have to screen whether UCare or TCare is needed, because in every case UCare cannot be done, but wherever it can be done, UCare is a revolutionary surgery. It's a miracle and it's a life-changing surgery, because the recovery is really fast and the level of activity are higher than TCare. So just to remember, like this is our knee joint, and this is it's a junction of two bones where multiple cartilage ligaments are involved, and this wears out the way our car tires wear out, and this process is called arthritis. It can be multiple types of arthritis, but end result is wear out and deformity, like bending. Like our legs are supposed to be straight like that, in osteoarthritis starts bending like this on standing. So the bending is obvious on standing, so we need to do a standing x-ray. Any lying down x-ray may not so, but standing, the bending is obvious on standing. And we have seen that this bending results because there is wear out only on one side, and the other side is perfectly okay. So there is wear out only on one side and the other side is perfectly okay. So this leads to bending on that side, the wear out side. So that bending is obvious on standing. So in knee replacement, we replace this surface. Knee replacement is basically knee resurfacing. Knee replacement is basically knee resurfacing. We replace this surface with a new surface. So this is what is knee replacement or a knee resurfacing. Knee replacement and knee resurfacing are synonymous. They are the same term. They are not two different terms, because knee replacement is essentially knee resurfacing and realignment. But in we saw that in multiple cases, many cases, only one half is worn out. That is causing all the problems. So a revolutionary idea came to our mind that we replace only this small one half. We replace this part with a small bottom-like implant. So that corrects the bending like that gets corrected, and that gives very good pain relief, and the recovery is really fast. This is a minimally invasive surgery, several times stitchless, without stitch we can do, and the recovery is really fast. So this is UCare, and to talk about UCare further, we'll see it, but just to point the recovery, the person starts walking from the same day of surgery, released after 2 days and 1 or 2 days, and one can start walking outside outdoors within say 8 to 10 days, and one can join office by 20 days. So it's really fast as compared to TCare, and it's a painless surgery, the UCare. So just further understanding UCare, like this is a X-ray wherein it is shown that the knee is worn out on one part only, and that leads to bending. The wear out is only on the one side of the knee, one half, not only on the inner half. Let's be precise. This is the inner half which is wearing out, and this leads to bending. So we replace this inner half with a implant which is known as UKR, unicondylar knee replacement. So this is what it looks like. This is the implant. It looks like this, and this is unicondylar knee replacement. So to understand the difference with total knee replacement, both the surfaces used to be replaced, like the inner surface as well as the outer surface, and in UKR only the inner surface is replaced. So it's a small bottom like implant which is put that corrects the bending, and but of course it cannot be done in every case. What we call it as correctable varus, in that case only we can mostly do it. It cannot be done in every case. So to demonstrate further, this is the X-ray. This is the wear out that has taken place on one side, the inner half of the knee, and that leads to bending. So we replace this with a new implant, and this is known as UKR. So this is a healthy knee. The wear out takes part only on the inner half, and this inner half is replaced by a small bottom like implant, and that is known as UKR. Several cases, this inner half wear is accelerated because of a previous meniscus injury, previous cartilage injury. So this is the meniscus. It's a washer like cartilage. This meniscus gets injured several times in a trauma, in a twisting accident, in a sports injury, and the meniscectomy is done several times, meniscus repair is done, and this accelerates the wear in the inner half of the knee, and this accelerates the wear in the inner half of the knee, and that inner half wear and tear is replaced by a small implant which is known as UKR. Only thus, as you see, only the inner half is replaced, the outer half is left alone, which is not the outer half which is not needed to be replaced is left alone. And the beauty is that all the ligaments are preserved, ligaments and the cartilages. So this is the thing, and this is the inner half surface. Again, it is only a surface replacement, inner half surface replacement. So this is the implant, and to demonstrate further, like this is the inner half replacement and this is the implant. So the beauty of this surgery is that these ligaments are preserved. This is the ACL, behind that is PCL, these are the collateral ligaments. So all the ligaments are preserved. So it is a joint preserving surgery which specifically targets only the diseased part and preserves the ligaments and cartilages of the knee. So this gives a very natural feeling. It is a high performing implant. It gives a better quality of life, and it enables one to sit cross-legged and sit on ground also if needed, and the recovery is really fast. It is painless, blood loss is not there, there is no need of blood transfusion, we have been doing both knee replacements in single sitting since more than 2 decades, and we have found that especially in cases in which both knees in single sitting needs to be done, UKR is very good option whenever feasible. Again I repeat the word whenever feasible, because it may not always be feasible. So it's a very good option. And the positive aspect of this is that we will not need blood. We don't need blood. It's a painless surgery. Recovery is really fast. The risks are almost nil, almost nil, and we don't need blood transfusion. So it's a more precision surgery. But let me tell you, the cost of UKR is not less than TKR. On the other hand, it is several times more than TKR, because it's a very high demanding, high precision surgery, and implants may be costlier than TKR also. This is about UKR. But another thing I would again like to point out is that whether your knee needs UKR or TKR can be decided only by the surgeon. It cannot be decided by you, because there are criteria for it, and whichever we normally keep both UKR and TKR ready always, and we go ahead with UKR whenever UKR is best, whenever TKR is best, we go ahead with TKR. So thank you.